Hello, my name is Mueller. I'm a physical therapist over at the Biltmore clinic for Foothills. I have been here for 4.5, almost 5 years now, and I'm here to talk to you guys about posture. So all of us have posture problems. PTs aren't perfect either, so we're going to talk about desk work, postural stretches, exercises to kind of help make things a little bit better. Bad posture can look a lot of different ways. It can be hunched over, it can be texting, it can be sitting back like this, it can kind of be bringing your computer on your lap. Bad posture can be reaching too far. Bad posture can mean you have one computer and you sit kind of crooked. It can mean you have two computers and you're always looking to your right. Stuff along those lines. You want to make sure that you are not biasing one side all the time. That's really important. You want to be able to have a good vision ahead of you. That we can get into more ergonomics another time, but posture is really important. Sometimes that, like, you hear the posture word and you just want to correct, so the best thing that you can do is try to be attentive, but also set a reminder on your computer or on your phone. Check it out and say, oh, I'm going to recorrect. It's a really easy thing. We know how to make it better, but it's not a habit yet. So that's one of my recommendations that I like to do for myself. I'm going to show you a couple of exercises, stretches, and different types of movement patterns that you can do to work on stretching if you're feeling tight and limited. A lot of what happens when we sit is we get tight in the chest and we get tight in our hips, and so the important thing is to kind of stretch that out and make sure that feels a little bit better, as well as strengthening. Strengthening is a huge component of posture. If you're able to strengthen your, what we call the posterior chain, or your back in between your shoulder blades, low back, and your core, it's going to be a lot less work for you to actually maintain that posture for longer periods of time. So stretches you can do as often as you want. If anything starts hurting, please limit that. It shouldn't be painful. Stretches should just be a nice, comfortable stretch feeling that we get going on. Exercises, you can overdo those. You don't want to jump in and do 100 right away. You want to start slowly. The wall walks that we'll talk about do get pretty fatiguing and tiresome. It's a muscle group that's pretty weak in a lot of people, especially if you have postural weakness. So you can just try working up your way to doing 15 times a day and seeing if that gets a little bit better. The bilateral external rotation, that one's a pretty great one. You can't overdo it too much unless you start feeling a little bit of pain in the back of your shoulder. I don't want pain, I just want you to feel the muscles engaging. After you've been sitting hunched over at your desk a lot, or working on the computer, texting, sitting on the couch, your upper back gets pretty stiff. When you're really stiff, that kind of brings your shoulders forward. Something that's really important to improve your posture is to open up your chest, stretching your pecs, as well as getting a lot of extension into your upper back. So Kyle here is going to put his hands cradling the base of his neck. I'm going to have him protect his head as he's coming up and leaning up and over and arching. Good. And then coming right back up, getting a nice little stretch there. You can do it repetitive times up to, whatever kind of feels good. Good. And I'm going to have you come back up. If you're feeling comfortable, you're like, that upper part feels pretty good, he can scooch his bottom up. Great. And now he's going to again position and arch his back. Important thing is I want you to try to keep your hips on the ground. I don't want your hips coming up. And make sure that you're focusing on really getting your upper back to arch back and up. And so this is called your thoracic extension. All right. So this is the couch stretch. All you need is a wall. You can put a foam pad underneath, sometimes roll up a yoga mat. You can use a pillow, anything underneath the knee just to give that a little bit of protection. The height does not matter there. So what we're doing here is keeping your pelvis tucked down, that tailbone tucked down, getting a nice stretch, leaning forward just a little bit so you feel a really great stretch on the front of your hip flexor. This is again called the couch stretch, and we use it here to open up our hips, because so much what we do when we're sitting is we keep our hip flexors, our psoas, all of that gets really tight. Kyle can come on out and he would switch legs. Good. And he's come back down. Sometimes patients do have a little bit of cramping in their hamstrings afterwards. That just could be a sign of tightness, so try to wiggle that out a little bit as getting into the stretch. More so important of just really focusing on that front of your hips. Bending over is going to take away the stretch. Sitting up is going to be much better for you. So this next one is called bilateral external rotation. We're going to be focusing on using the back of your shoulders to open up the chest there. Good. The whole purpose is to strengthen the back of your shoulders, as well as getting that upper back thoracic extension, middle trap, really working on that posterior chain to stay nice and strong. This is great for shoulders as well as that postural position here for you. Nice, slow and controlled. If you go too quickly, that's going to kind of take away from this exercise. The whole purpose is to recreate that strength in the back, making it nice and tall and good posture. So next here we have an exercise called bird dog. It's a very common one used in physical therapy because it's great for dynamic core stability as well as creating a good trunk control here in the back. So as we're doing this, I'm gonna have him first lift just up his back leg here to engage the back of his glutes as well as his lower lumbar spine. And then as we get advanced, we're gonna open up and use the opposite arm up here. So we're creating a good multi-chain use in the back of the shoulder, working on that posterior chain strength as that's going to help with posture. So then he's gonna come back down, hands down, feet down. We're gonna come opposite. The important part here is you don't want your hips to shake a little bit like that. So keeping your core engaged, really tummy tight, come back down. And then we're gonna switch again. Good, really make sure that core stays engaged. You're not rocking your hips, keep things nice and even. So this is called the bird dog again. We do this repetitively until you start feeling a little bit fatigued. If it is too hard to do the opposite at the same time, you can just start with just doing your lower extremity and then switching up to your upper extremity as well. So this is great for, because it's doing the upper extremity, this is great for shoulder stability, this is great for core control, this is great for sitting, this is great for creating strength in your back. So it's a really good all-encompassing exercise. So there we go. So these are called wall walks. These are great for scapular strengthening and scapular stability, which is a huge component of your postural strength and that posterior chain here. So the most important thing here is that we're working from the back of our shoulders, not the front, as well as keeping our wrists on top of our elbows. Letting those come in is going to be a compensation and a sign of weakness, and what we want to focus on is resisting that band as well as keeping those elbows underneath the wrists there. So that is a great exercise. You will fatigue fairly quickly with these, so don't be too hard on yourself. Take a rest, relax, and then do them again. So these exercises and stretches should not only prevent onset of pain of your neck and your shoulders or your low back, but hopefully if you are experiencing a little bit of that, you can give these a try and see if that helps decrease the pain, decrease the soreness, or just all around stiffness that we may have after sitting at a desk for a long period of time. So thank you guys so much.